Hello, and thank you for coming along to this introduction to some sources to track and examine the impact of the coronavirus pandemic in Africa. We're going to do some research in available sources for anybody with access to the internet. Boston University Libraries has a particularly strong connection to Africa, and anyone can log on to it who has an internet connection. Once you log on to their main page, you can look for research. The category research is down in the left-hand corner of their top page. And if you click on that, you can get to the research at Boston University Libraries. Look over in the right-hand column, you can get to library guides. And library guides has several different categories. We're looking for research guides over here in the right-hand corner again. And when you hit that, you can get to a list of the research guides that they put together over the years and arranged by subject. This one to pursue is under African Studies itself. So if you click on the African Studies link, you'll be taken to the list of the 47 research guides that they put together. And the most recent one is on Africa and major disease outbreaks. It's an amazing collection of links to help you get into the research on Africa coronavirus. It was put together by Gabe Adunya, a professional librarian, one of the 3 or 4 professional librarians from the university system to devote their entire attention to Africa. So, within the Boston University Libraries, look for Gabe Adunya's Guide to Africa and Major Disease Outbreaks. In his About This Guide section, right here, he explains that it's not just the latest news, but placing this within the context of disease and pandemics and epidemics that have roiled throughout the African continent for hundreds of years. So this is a kind of window on that whole range of literature which he brings to our attention. Because of the currency of the current crisis of COVID-19 worldwide, he focuses initially on the disease outbreak news. It's very useful to get right into the news for areas that you want to do research on. You may come from a part of Africa and want to find out what's going on right there, or you may have studied there, or you may be doing research on an area specifically related to that. So getting access to the disease outbreak news is crucial. And he includes 3 key sources, which are supplied on RSS feeds. The All Africa News Source, their help desk, is one. Another one is the World Health Organization's Africa Regional Office. They have a news feed as well. And a third one is the Africa Newsroom Health Service, Health News Service. So you can see as you change these, they will change, and we can show this in a moment interactively. They will change their sources of news, and in doing that, you'll get access to different kinds of material. So let's take a look at an interactive page that Gabe Adunya has put together for us to look at these sources. Individual librarians draw up these resource guides, and information can be contributed to them to include in their initial research guide when they provide updates to it. When we take a look at the page put together by Gabe Adunya, we can see right away that the disease outbreaks, and particularly COVID-19, are put in the context of a much larger frame than just the current news. He provides links to a whole range of things that we can discover bit by bit. At first, though, read his About This Guide background material to describe that. Then you can get right into the news material by clicking on Disease Outbreak News. And there you'll see that there are 3 different sources of news. As you click on the different sources, they will have different titles down below because they're each bringing in a different range of material. It's current material, and the most recent is listed first. So here you see there's material listed from July 10th, and in this case, July 9th through 10th. You have a title and then an information box. The title is the overall title of the news source. The information box gives you usually the first paragraph of the story concerned. So, for example, on this case, you can look at the fact that the story talks about how to prevent future pandemics, stopping the spread of virus from animals. And it links through an initial paragraph, which starts off talking about Ebola, SARS, Zika, HIV, AIDS, West Nile virus, fever, and COVID-19. These are some of the highest profile diseases to emerge in the last several decades. And while they emerged in different parts of the world, they have one thing in common. They are what scientists call zoonotic diseases, infections that jump between animals and humans, some of which leave illness and death in their wake. Well, that's the summary paragraph of the first part of the article. To click on the full article, you click on the title itself, and you'll get right out to the full article, usually with an ad in between. But don't worry about the ad. You can scroll down below it, and you can see this whole question of how a new report examines how to prevent future pandemics. Here's that first paragraph that we read by clicking on the information above, and you can see that the information then follows on the whole topic. It's put together, including links within it to the report that they're referring to. You can click on those links, which are out at the UN Environment Program, and get the whole report on the zoonotic diseases and how they break the chain, how we can break the chain of transmission. So you get the point. These are enormously powerful resources. A current news story, which we looked at from the news feed within the Boston University site, led us right to a story which then carried us to a UN report, the full text of which we could read online. You can look at various country reports and news stories from within different countries, like this one from Kenya, for example. Kenya. Country loses its first doctor to COVID-19 as cases surge to 9,448. Sad story of the first recorded death of a medical doctor, raising concerns on the safety of the healthcare workers throughout the country. If you scroll to the bottom of articles like this, you can see where they come from. And you can see that the ... here means that there's a longer story. So you can go out to read the original by clicking on the original and going out to the story itself. This way, it's much more possible to get updated information that's quite a bit more detailed. If you click on their homepage or their page for the coronavirus connection, here you get the story. Kenya loses first doctor to COVID-19. Now that's the one that was indexed back at the Boston College page, put together by Gabe Adunya. That's just from the All Africa news sources. Now, you can very easily understand that you could go through this on a daily basis, since these are updated several times a day, and get information from different countries in Africa and different problems in Africa. Here in South Africa, the minister confirms a total of 238,339 cases. This is an extraordinary size, and the data source is then provided here. And when you go down to the different sections of South Africa, Eastern Cape, Free State, KwaZulu-Natal, and the like, you can get the breakdown of the different numbers. And you can get, once again, to the original article of the government site of South Africa. So you have two links there, not just to the original article itself, but also, here's the South African government site, giving you those statistics, but also to the larger government webpage that provides this. Now, this is very extraordinarily powerful, because you can see that there is a newsroom there within the South African page. And if you're carrying on research, you can go straight to that source material from the links provided through Gabe Adunya's page here. This is just in the news source from the All Africa News Service. The WHO, the World Health Organization, has an African regional office, and they have featured news as well. If you click on that tab, you can see what they've listed for the 10th and the 9th and the 8th. This isn't updated quite as quickly as the All African News Service, but the WHO puts out regularly updates from different countries and on different problems. This, for example, is provided by the 9th of July, the COVID update. Now, a COVID update is very important because it comes out periodically and gives you an indication in different parts of the continent where things are happening. In this particular case, you're getting this from the Rwanda COVID office. I should say the Rwanda World Health Organization office, which has, in effect, its own website that you can click through to and find out about the Rwanda Biomedical Center and its latest updates on the disease. So you can see very quickly how you can get to valuable resources from the news feeds off of Gabe Adunya's first page. Here you get more specific stories about how the WHO is donating equipment and transport facilities to work particularly in Zambia. So you can follow this country by country and get right to the source material behind it in every case. This is authoritative material from the World Health Organization in Zambia, whose directory you can get straight to by clicking on the top effort of the Zambia news story and get country information about the total situation in Zambia. So all of this is a helpful step. If you click on the third tab, you get, in effect, updates from individual African countries, as well as sort of indications of the first paragraph if you type on the information material. And you can get updates from places like Uganda and Nigeria by clicking on the title itself. When you click on the title, you get usually the update from Kampala with a story about the latest material. An indication as well about how you can link out to other sources in Uganda and get their headlines. So if you're following Uganda in particular, you can see what's coming to the focal point of research within Uganda on the coronavirus crisis. A lot of these stories include what the member states are doing across the continent, member states of the African Union. So you can see what's being coordinated continent-wide as well. So this is a very important source of updates that are current. That is, this is the 10th of June when we're looking at this, and the stories are in from the 9th and the 10th of June. Browse through this, get to the downloaded material, find the material behind it. In this case, we're looking at Sierra Leone and a broadcast statement by His Excellency, Dr. Julius Maada Bio, President of the Republic of Sierra Leone. This is the broadcast statement, and so you get a sense of how the government is taking this problem very seriously. If you're doing work on Sierra Leone, or if you're from Sierra Leone, make sure you can take notes on this electronically. You can print it out. You can copy the text. You can copy the text into anything that you use on your own micro computer at home, or you can take segments of text, copy it, and paste it over into an empty page like you may be using for a note-taking system. In any case, access to these news sources is absolutely crucial, and it's the first part of what you can get to through the news threads and the RSS feeds provided here on the research page from Gabayadunya. In addition to news, there are sources on the left, in the left-hand column, that Gabayadunya has provided for us to look out for well beyond the news sources. For African studies and health, for example, there's the Alumni Medical Library over at BU, which can be drawn upon and has very current information on the coronavirus in general. It's not specifically looking at Africa. It's on the coronavirus as it's being studied by the medical school at BU. There's also the coronavirus in Africa, which we'll look at a little bit later because of the selected sources it brings together specifically for Africa. Then there's COVID-19 research that's being done well beyond, again, Africa, but on a global basis, and various kinds of other links that have been provided on the left-hand side to go out to the Center for System Science and Engineering at Johns Hopkins, for example, one of the leading centers that's looking at how to use data from around the world to understand the evolution of COVID-19. Anyway, you can move among these different sources here, click on their information button to find out what they contain, and look more thoroughly at other sources beyond just news sources that are important for the discussion and understanding of the evolution of the COVID virus in Africa. Let's look particularly at this COVID-Africa connection. There are selected sources there, and in fact, if you look at it in detail and click on the information page or the information circle there, you can see that it's focused on Africa itself, but beyond Africa, it has selected resources on the coronavirus in the world, in Africa, and among the Africa diaspora. Now that's an interesting idea. That is, the Africa diaspora is being tracked as well as African people themselves, especially because they've had connections through family or trade or transport. We're also told it's under construction, and it's an evolving database in that sense, evolving reference weblog with links to data sources, reports, discussions, and selected news. So there are different kinds of things that you'd find in this connection, not just news feeds, but discussions and documentary reports and the like. If you click on that, here's what you'll get out to. A preliminary directory of research resources. As it says, selected resources on the coronavirus in the world, in Africa, and among the African diaspora. Let's take a look. So in the left-hand column of the page, you can see, in fact, that we can connect to these various resources here. The African Studies and Health material is over at the Boston University Alumni Medical Library, and it basically connects out the databases on the different kinds of journals that are brought into focus on this whole question of international health and travel. Now, this is put together long before the COVID virus concern, and it has a whole series of other kinds of resources that can be drawn upon to look at the coronavirus in Africa, but it's not specifically aimed at the current circumstance and how that's evolved. It's a generic research platform or research guide put together over at the Alumni Medical School Library for African Studies and Health in general. So it's not specifically on the coronavirus, but it could be quite useful. COVID-19 research is being undertaken in a number of different areas in the Boston University system, and that research is sort of reflected off the pages of this connection from the left-hand side of the directory. Down at Johns Hopkins, the center is a little bit more focused on the whole question of how to communicate internationally. So they've been working on developing things like dashboards. They call a dashboard a kind of central area where you can look at the entire world. The Center for System Science and Engineering, CSSE, at Johns Hopkins has put this together. And again, it's putting Africa in the context of the larger world, but although it has many advantages, and you can zoom in on the map to some extent, it doesn't provide a great deal of detail in each country. There's only one data spot for each country, and that's summarized, that data. You can click on that and get the total number of cases that are confirmed, along with cases that may have ended in death. But this is of limited utility if you want to look beyond the gross statistics, that is the large-scale statistics. Johns Hopkins has been doing it for the world, and it's becoming apparent that India is taking over after the United States and Brazil as the biggest hotspot for the most swiftly emerging aspects of this pandemic, and that Africa, in relative terms, is not as overwhelmed as other continents are. This is certainly something to monitor, but if you want more detailed material on different African countries, you probably have to go back to this question of the dedicated site here, Coronavirus Africa. It's still a preliminary directory, but it is starting to list the sources where you can get more detailed information. And in particular, it's listing the Africa CDC, the Africa Center for Disease Control, the World Health Organization's Regional Office for Africa, and the US CDC. The United States Center for Disease Control has a presence in Africa, and it's been there for quite a while. Its current material is rather static and doesn't get updated very well. It's, again, country by country available. You can click on a particular country and learn about it. So that here, for example, you can get their information about what they're doing in Ghana. And country by country, you can click on it, Benin, and find out what their Benin program has been. But again, it's of limited interest to those interested in African research and African circumstances, because it's compiled largely from data sent from these US CDC centers back to Washington and then compiled in CDC reports for each one of these countries. It's not as current as the kind of news that you're getting on the BU page. The CDC Africa page is quite a bit better, but it too has the problems. It's put together by the African Union and the Africa CDC. If you link into it, you can see that, in fact, there's a lot of very excellent information on how to protect the public. Here are the daily updates and the African Union response. A lot of this is official, and some of it is boilerplate in the sense that it's a kind of form-filling operation. There are regional sections, and there are country reports, all of which are very important to review on a regular basis, particularly the Outbreak Brief. The Outbreak Brief is a periodic outbreak report. You can see they go from right to left here, the left being the most recent. Brief 23 was on June 23rd. A week later, Brief 24, a week after that, July 7th. Now you can expect one to come out on July 14th. What is the Outbreak Brief? Well, click on it and you'll see. It's largely a statistical overview available in several different languages, including Portuguese, French, and English, and it's downloadable. So it's quite useful for detailed documentation about what happened during that particular week. But once again, it may not provide the kind of level of individual country updates that people may be looking for. It tells you what the African Union is doing on one level or another, commissioning to launch a consortium here for a vaccine, official statements in both French and English. A very important site to keep in touch with, the africacdc.org. In addition, it's possible and important to look back through the, in effect, the material that's provided on the World Health Organization site. Now we can do that by going back to this collective link here and look for the WHO regional information. This has, in effect, more timely publications and more detailed publications. Again, they're issued in reference to situation reports. I've listed them here in this particular web blog listing in terms of the most recent one on top, which was back at June 10th. Well, take a look at the more recent ones, And you can see that these are updated, again, once a week, basically. If you go to the World Health Organization coronavirus updates, you can get their update for Africa very quickly. You can get the statistical information, but in addition, you can look at these situation reports. Now, this is for June 10th, but it's been report 15. You can find them much more currently by looking at the report material. Let's see if we can find it from the coronavirus page and scrolling down to the situation reports. Yes, here are the situation reports for COVID-19 for the World Health Organization, Africa Regional Office. That's what AFRO stands for. And the latest one was 2 days ago. This is the 10th of July, but this is the 8th of July situation report update. This is very important for the statistical summary of what's been happening for the whole continent over this last week. You can get the details within each of these paragraphs, but more helpfully perhaps are the trend lines that are seen not only in the tables, but in the graphs. You can see where the heavy concentrations of things are, the outbreaks. In South Africa, in this case, as you can see where the other countries line up in this respect as relatively important, the overall surge in the continent. And you can see what other kinds of graphic material are available. These, again, you can use for any kind of reports or research you want to pursue. You can enlarge them, capture the dynamic of it in your own computer system and use them as slides if you're trying to illustrate something in talks to your colleagues or students. Important to catch up on a weekly basis with what's happening. The outcomes are very important here as well, because although a lot of mortality is being registered, it's not evenly distributed, and it's not, in fact, anywhere near the amount of people that have contracted the disease. It doesn't mean that you're automatically going to die from it. But those trends change over time, and they're different in each country. So here you get the Ivory Coast, for example, the Cameroons, or Kenya. And in the case of Algeria, there was a large component of deaths here and a kind of differential component over time to the way the curve emerged. All of these are moving towards larger and larger caseloads, as we can understand. But it's important to get a sense of the details that you can get from these situation reports. This is the kind of breakdown in terms of a population pyramid of who has contracted the total number of cases of females versus males, and the age categories. It's the age category 31 to 39 among males that's been most dominant throughout the continent. These may reflect the need to go to work and get into contact with a lot of other people on public transport or in work situations themselves. In any case, that kind of trend can be tracked from week to week in this situation report. So I'd urge you to look into the situation reports as a regular way to look at the updates 1 week after another. If you went back through situation 18, 17, 16, 15 was the last one we listed on the web page, but you can get them from the June 10th and onwards through these links provided on the Africa page for the World Health Organization. regional page, regional office for Africa. Okay, well, beyond that, in fact, you can get a range of other material from this website put together for the different sources on Africa, in particular in reference to South Africa, where there are a lot of things emerging. The South African government has put together its own coronavirus information page, and that deserves close attention if you're working in any part of Southern Africa. This is the Health Ministry of the government of South Africa, and this is their resource portal. You can find out information, again, on public health issues, that is, how should you prepare in the public, and basic information on what is COVID-19, economic guidelines and relief, and the like, and then statistical information, as well as an update by day of the different regions within South Africa. So, for example, this is today's date, and if we click on this, we can get the news releases about the 10th of July. See what, in fact, the Eastern Cape, the Free State, KwaZulu-Natal, what the rates of cases are and what the performance in region by region has been in terms of the outbreak and the number of fatal cases. This is very important for people doing work on South Africa. So I'd urge people to look into that link off of the coronavirus page, that is the one that's generally linking things to Africa. You can get right to it by going to the South African coronavirus news and information. There's also material from South Africa because the news sources have put together the coronavirus dashboard. This is from the Daily Maverick, a Daily Mail down in South Africa, has put together a kind of daily update, again with the numbers from the Free State, Northern Cape, Northwest, KwaZulu-Natal, and the like. So those of you doing work or wanting to get in touch with people or circumstances in these areas should look very definitely at the Daily Mavericks coronavirus dashboard, as they're calling it. It shows the number of tests performed as well as the recovery rate, which is pretty impressive. This is an important daily update, and again, if you're working on this part of the continent, it's crucial to keep in touch that way. In addition, this page links things to other sources outside of Africa, but working on the COVID virus. In this case, we get the New England Journal of Medicine's reports on COVID-19. This, again, is not limited to Africa, but considers COVID-19 as a global phenomenon, and many of its discussions have to do with populations here in the United States. But the New England Journal of Medicine is really quite an important source for medical information within the Americas, and for that reason, it's included here. There's also information from Harvard. Harvard has a number of different initiatives. The Center for International Development, for example, has its page now at the Kennedy School on the COVID-19 response and resource page. Very useful to get out to that. There's the School of Public Health, known as the T.H. Chan School of Public Health, has its own focus on the coronavirus, COVID-19 response, public health in action. And there are great many sources of material that you can get access to from their webpage. Find out who's working on it, what research projects are underway, and the like. Furthermore, the Center for African Studies at Harvard has put together a very powerful COVID-19 resources page. And in fact, have been for several months now, a seminar series. And you can get right out to their seminar material that they've been running as webinars ever since the 13th of May. These they've made available in Vimeo so that you can capture them and look at them individually. Combating Racism and Xenophobia during COVID-19. This one's shared experiences with COVID-19 in African and African-American communities. Here we are talking about African healthcare response, COVID-19 in the African economy, race to the vaccine, with important participants from all over the world, but largely focusing on Harvard's faculty, as well as those that Harvard alumni who have become very important in this work. On June 17th, they looked at the African workforce, implications of COVID-19 on food and nutrition security was discussed in April 24th. July 1st, implications for education were discussed. And July 8th, just the day before yesterday, the future of Africa's health systems were discussed. Now you can get access to these things and take a look at the video provided behind them just by clicking on the access here. And you can
Good morning and good afternoon, everyone, and welcome to the future of Africa's health systems. We are delighted to have you with us today and a wonderful group of experts from Africa and on African affairs who will be sharing with us their response to the current crisis and the future of the health systems in the country. My name is Margaret Crook. I'm a professor of health systems at the Harvard T.H. Chan School of Public Health, where I study health systems in sub-Saharan Africa together with a host of wonderful colleagues throughout the continent. So it's a particular pleasure for me to be here to listen to the experts dealing with this crisis firsthand. I want to say a little bit about the Harvard Center for African Studies, which is an institution here at Harvard University, and it has had a long-term collaboration with the Africa Centers for Disease Control. And together they have been hosting webinars intended to provide an accurate depiction of COVID-19 in Africa. And today is the last webinar of the season before we take a break and start up again in September. So a little bit about housekeeping. After we hear from the panel discussants, we will open up the floor for questions via the Q&A function on Zoom.
Well, you can participate in some of these as they went along. They'll be resuming maybe in the fall. But here we have, in fact, the director of the Africa CDC. As she mentioned, this is co-sponsored by the Africa CDC and the African Studies Center at Harvard University. And it's really quite a treasure trove of discussion about the problems having to do with the coronavirus on the continent. So check it out when you can and listen to it for the kinds of information you want to work with. It's very important. Beyond this, you have access to other things through this center as well. And in particular, you can call upon a new kind of resource that's beginning to develop throughout all the English-speaking world. The BBC News system has been working on coronavirus as a special category of their research, and it's possible to catch up with what's going on through their news system as well. In addition, occasionally selected stories are presented here in a way that can be shared and discussed in classes or among friends or among people who want to do research together. Finally, we ought to look at a little bit of the maps that are available. Maps are a way to get into data, and a very powerful way to get into data very quickly. This one is particularly helpful for local data on Africa. As we looked at the Johns Hopkins material earlier, the worldwide representation with only one circle per country. That was helpful for getting a sense of Africa's role in reference to the rest of the world and its magnitude of problems in reference to the rest of the world. But if you want to look in detail at particular parts of Africa, a resource like this is far more helpful. First of all, you can zoom in at a greater level. And more to the point, you can click on particular countries, shall we say the Cameroon, and get the data summarized above with a new, much more detailed map that has points on it that indicate health centers that have reported data. Once again, you can zoom in on this material quite far to the point of detailed information and find out about particular spots, like Douala, for example, 3,211 cases. If you click on that material, you can also get out to where it was compiled. The last data source was the 6th of July, and it gives you, in effect, the information data, a JPEG of where it came from. Now that can be used by people doing specific research on a very refined level within particular countries. If you zoom back out, you can see that, you can see right next door, we're into Nigeria. And once again, you can look at places like Benin City or Onitsha that have their own sources of information. Delta is said to have 1,337 cases. The source material there was last updated on the 10th, that is today, we're looking at it, from the Nigerian COVID-19 site. So again, you can get to much more refined and precise information through the use of these maps that are really quite helpful. So I'd urge you to check out the different resources available through the Africa indexes, maps, and graphic charts. In the future, we'll be looking at this in detail because it is part of what the Africa Map Circle is putting together as a map and graphic sources guide to track and analyze the impact of the coronavirus. This is something that we can look forward to in the future. It's not fully developed yet, but the maps and the charts are particularly important as the disease evolves on the continent and spreads, perhaps not as fast as in India and in Brazil, but nevertheless spreads throughout the continent of Africa, both in rural and urban areas on a massive scale.